paid up, and we want to think about creating space. Probably sit, swing the leg around, do this little foot, and we think of a bunion having a little kick, right? All right, we're back for another episode of Anthro Health, and we've got a bad mother effer. It's an explicit podcast, so I could cuss, but hey, who cares? He probably will. But we have Dr. Brett Winchester, who was one of my most influential mentors coming through school and even still after school. So real quick, I know you were actually one of my first guests way back when I tried to give the podcast world a run like 4 or 5 years ago. So welcome back. But
Yeah.
give us a real quick, maybe not full intro, but like, what have you been up to over the past couple of years? What's been the evolution of Brett Winchester in your practice, man?
Yeah, I would say in the last 5 years, of my life has been basically baseball. So this year, I'm no longer with the Cardinals. So I'm still in charge of DNS baseball. So I still, as much as I get tired of baseball, I'm still in it quite heavily. But yeah, so, I would have to say the last 5 years of having to be at the stadium so much, was basically that. But during that time, I also kind of really evolved my clinic. I really was kind of seeing how important the 3 pillars, what I felt for our clinic, that were most important. And that was training, functional medicine, and then, the treatment model that well, which is kind of the combination of MDT, DNS, MPI, neurodynamics, and then how to best integrate and combine all those together. And that's basically where we've come up with like Gestalt education, because I guess the biggest hole with the students, and it's not just at Logan where you were, it's all over the world, is people are not good at integrating these techniques together. Like my students have all been to all these seminars, but then at the end of the day, what they're not great at is knowing when to use what tool at what time. So that's kind of been what I've really been working on with education. So I started teaching at Maryville, and so I'm trying to really take the next 5 years of my life. I just turned 42. So I really want to take the next 5 years and really, really spread my wings in the education department. Because I just feel like for the past 5 years of being so involved with baseball, that's all I thought about. And I wasn't able to spread the word on a lot of the side stuff that I've been working on. So now, that's what this time is going to be about for me. So
what are you teaching at Maryville?
Advanced biomechanics. And I think actually since I've talked to you, Beau, I now teach adjusting at Logan now.
Nice.
So that was like the big thing. And I have some other things I'm kind of working on with some other big schools locally here. Hopefully that'll come to fruition. So I really, right now I feel like that's my calling. And, I feel like literally every single day of my life, I evolve like so far, that I don't know. It's just like it's like a really crazy thing as all these different things are colliding together. I just feel like every day I'm exponentially better than I was the day before, just because I'm paying attention better. I'm implementing better. And, I'm just kind of coming into the prime of, my life as far as an age standpoint. I feel like I've been at this long enough now to where I've seen everything at least once or twice. And, I'm in a good spot right now. So,
that's a testament to why I think you are one of the, change agents within our field, is what you just said, is that you're willing to constantly evolve and have your radar constantly scanning for what's out there, but also you've created a really good filter through the schools of thought that you've come from to allow yourself to properly assimilate information, but then also integrate from an application and treatment standpoint. So that brings me to my first kind of point of today.
Watershed moment. Is that what you're saying?
Yeah, man. Yeah, we're going to get there. All right. But what I kind of see you as in practice, and it's a lot of clinicians, not just you, is this kind of beautiful marriage between old school and new school. And what I mean by that is if you take really the principles and ideology of something like DNS, that is very, the development of that started, decades ago. And then you think of all these ideas and then things that are, have changed in maybe the past 10 to 20 years, neurodynamics and MDT and these things that have, kind of come along and really taken flight. How do you put something against, against your filter? So say you see a technique or a piece of literature come out and it kind of maybe challenges what you've done before. It's completely new. How do you weigh that? What's your process for going in there? Being like, I'm not going to look at that, or we may incorporate that. I need to learn more.
Oh, I think, it kind of happens naturally, like, especially with me being on the teaching circuit, you have what I would say, what is seminar fluff. You sign up for a 4-day seminar and sometimes at the end of it, you're like, man, we could have done that in a day and a half, So I think like you naturally learn how to kind of sift through. That's what clinical practice does for you, because if you're seeing a patient every 15 or 20 minutes, you don't have a choice. Like, you've got to get to the meat and potatoes of what's going on. And I think too, like, I think every modality does have its place. I just think like the assessments where it's all at, to be able to know like where you're going to, apply those. And I think DNS has really helped me as far as like an overall lens. I think I look at everything through a DNS perspective. But then I've learned my hands through MPI and how to adjust. And I still think that's vitally important for our profession and moving forward. The present day student is currently where I see the pendulum has swung, the pain sciences, which I love the pain sciences. However, I feel like there's this new movement of all we need to do is tell our patients they're going to be okay and give them a pep talk, slap them on the butt, and everything's going to be fine. It's almost like biomechanics have just like been thrown out the window. And I guess I have a little bit of Stu McGill in me. I still have a little bit of a biomechanist thought process where, to me, like, I don't feel like I need an outcome measurement to tell me that I have a chronic pain patient in front of me. It's when I walk in the room, I know that patient, and I know I got to change my shtick with them. And but I think to treat everyone like they're a chronic pain patient, and that we almost need to mind F them into thinking they're actually fine, go live your life, everything's perfect. That's a huge mistake, because we have a huge skill set to offer our patients. Especially, the more I'm around like manual therapy, the more I realize this is a neurophysiological end. It's not so much a biomechanical thing, which it is, but that's not the big thing. Mm-hmm. So, guys like these top chiropractors in the country, they have so much to offer their patients. But sometimes, they're also the questioners in the evidence-based group, and they're also not doing some of the manual therapy that they actually should be doing because of this pendulum that's swinging. So I think, like anything, everything returns to the mean. So, we're in a little bit of a pain science brain phase right now, I think. So I think in the next couple of years, you'll kind of see that, kind of probably get back to probably where it needs to be, which is, perfect. When that patient walks in, by all means, we need to, read World of Hurt, and everyone on this planet needs to see Annie O'Connor talk. So, there's that's amazing for the right patient. But then let's not forget about our roots and how powerful manipulation can be and when to use it. And I think the other thing, the one thing we're seeing with research is the most powerful outcome is when you can combine manipulation with therapeutic exercise. There's nothing more powerful. When I learned how to adjust well and I learned DNS well, I felt like those two things created so many amazing miracles within my practice. And then I think as I've gotten more proficient with MDT and neurodynamics, those were kind of like the cherry on top. So I think I'm basically an amalgam of a bunch of different thought processes. But at the end of the day, we're chiropractors, and I know I have friends who are ashamed to tell people that they're a chiropractor. I have no problem sitting next to someone on a plane and being proud of what I am and telling them my story and, what I do and things like that.
Which is awesome, especially nowadays, because I went through this. I'll kind of open up, a little insight. We don't have, neither do you, but we don't have chiropractor in our name, which was on purpose. For a while, I was like, what else could I call myself? Right. So people don't come in here. They're like, I went to this chiropractor. I don't like chiropractors. I don't want my neck, all that stuff that we all have heard 100 times. But then I slowly realized it's not about me being a chiropractor. It's about me being better than everybody else I've ever seen as a chiropractor and setting a new standard for what we all should be doing. Right. And that's what we're all learning. But to back up on something you said there of how the pendulum swings, and we're on this kind of like big biopsychosocial, more on the psycho and social aspect. What I always tell my patients, and the more I've thought about this, the more it makes sense to me, and maybe I'm just confirming my own biases, but I always think of rehab as conscious and subconscious showing that you're better than you thought you were. And in that process, there's probably healing that takes place of tissue. There's probably increased and improved mobility through our techniques and modalities and treatments. But literally, I could probably get lucky if I went in and told 100 patients, hey, your pain's not tied to pathology, your imaging isn't tied to pathology. Or I could go through a small trial of care, which is the most efficacious way to approach a patient in the first place, and say, hey, in these 4 visits, we're going to explore a lot. You're going to get feeling better. And by the end, you probably do feel better. Now, then we go into the studies that look at, pre and post season NBA players and patellar tendinopathy and look at MRI results. Nothing changed. The pain changed, but that tendon is showing up with high signal still. I think that's what's happening all the time. And we're just like ho-humming along of like, oh yeah, that guy did knee surgery, pain neuroscience patient. Oh yeah, that guy's totally MDT. We extended him. They may be the same guy, and we're not quite seeing through the forest through the trees yet. And I'm not smart enough to say that's the way it is. That's just the way I think of it,
Well, I mean, that's a great point. I mean, I think I was listening to Jill Cook on a podcast in the last year, when she said what I'm about to tell you blew my mind. She said exactly what you said. She said, take your worst patellar tendonitis case, have a miracle treatment with them. They're 100% better now. Re-MRI their patellar tendon. Nothing's changed, which it's going to be interesting to kind of see how the soft tissue world, how they reconcile this information to see, if they continue down the adhesion fibrosis model or if they're willing to, consider another thought. I think everyone right now is a little bit on the fence. No one wants to say exactly what they want to say, which is there's got to be a different mechanism that is at play here, which doesn't take anything away from it. I mean, if I was a soft tissue guru, that I would just embrace it, swerve into it and say, okay, this is still obviously this is amazing. But we got to, talk about what the mechanism is and move it forward that way probably. Or we can, continue to do research and make sure that Jill Cook is in fact right on that, to where maybe that was just one unique case, but we are changing soft tissues in other cases. So we probably need to make sure that's all accurate before we, get exactly on that point. But yeah, it'll be interesting to see.
Well, that's where I like companies like Rock Tape, right? That are diving into the sensory feedback and what afferent, inputs are changing with different soft tissue mechanisms. And then look at, ultrasound studies paired with these. So they're, and Steve Capobianco is kind of leading the way there, and they're really trying to figure out what's going on here. Right. Which I really applaud, because they could just keep selling stuff to us and, sticking stuff on and wrapping stuff up and, scraping stuff, but they're not doing that. They're saying, hey, what is going on with these things that we know create change, but what is really happening at the tissue level and maybe even the cellular level? And the hardest thing there that when I had Capo on the show that we talked about is, are there replicable patterns that we can see with emotional change, right? Or how do they come into our clinic? What status do they come in? And how does that affect outcomes, which is really hard to pin down on empirical data. But if, that's being looked at all the time. So I applaud anybody that just thinks about what's going on when they do stuff, rather than just continuing to apply the same treatments and techniques over years just because it works. And that's fine.
Oh, yes.
But to continually question what you're doing is just magic of evolution, just like you said.
One of my kind of side huge passions is functional medicine. So when I have free time in my day, I just find myself always in that arena. And it is amazing how much what you're talking about, I think, plays into what's going on. For example, if you just took Durant's injury, last week, all the different things that probably led to that injury. He's coming back from another injury. fatigue, is there other metabolic problems going on, the emotional side of things, all of those create the perfect storm for catastrophic orthopedic injury, so we always think it's one variable. Oh, you had weak glutes, or you had, like in the ACL tear, but really at the end of the day, it's just a perfect storm of a bunch of different things. And, when we can start to, objectify some of those things and start to work on that, there's really good research on, injuries and sleep and things like that, 10 years ago, I would have nodded my head to that, but really not believe that. But now I 100% believe that to be true. And I think perhaps a lot of people are overtraining. I definitely saw that at higher levels where, athletes are just doing too much, they're working with 10 different people. They're, getting all this different treatment. At the end of the day, they'd be better off just to, have kind of a plan to their approach and stick to it and, rest.
So yeah, novel, right? Rest.
Right.
One thing I did want to talk about is what you were kind of getting into there. I know that you have a stellar functional medicine practitioner within your practice, Dr. Furlano, and I remember you telling me way back when I was interning at your place that if you go through a trial of care with somebody and it's not really just, gangbusters taking care of it, you're like, I can probably send them to Rebecca and she's probably going to knock it out, which I didn't really fully I think understand what you're saying, but the more you get into it, you're like, we're kind of all playing in the same sandbox. And sometimes just you got to grab that shovel or this spade. How much, and this is my question, this is kind of the root of this podcast. How much of the things that you see coming to your side of the office, musculoskeletal, people come in, man, my knee's killing me, do you really think is a functional medicine, whatever we want to say, that's an inflammatory scenario, whatever, autoimmune, and then vice versa? How many people do you think are seeking out primary care, functional medicine, systemic stuff that is truly musculoskeletal? And then how do we play in that overlap?
Oh gosh. I think that blend gets greater as I move along. Meaning when I started with Rebecca, I would have told you 5% of my cases needed to be referred to functional medicine. Now what I want to tell you is 90%. I'm not saying that I do that, but I'm a little bit of a hybrid. So I could be getting some blood work, or I could be changing their diet or having conversations about autoimmune disease now that I didn't back then. So I find myself just naturally talking about overall health with all of my patients, how important it is for them to move their body, how important it is for them to eat well. And then, I would say that my community definitely looks up to me in those areas. I'm living it myself. I would like to think I eat as close to perfect as possible. I work out, and travel a bunch. So, that's my downside. I'm always on a plane, but I do everything I can to, not be a hypocrite and, just be an advocate for human movement and treat our bodies well and things like that.
So let me talk about that real quick. Living by example in our field. So something that we'll jump back into that functional medicine talk. Something that I've noticed, and you know exactly what I'm talking about because you teach a ton and do travel a bunch. I think it's really funny that a group of chiros and PTs will sit around and rip up movement, like a squat, a lunge, running, baseball mechanics. And then they'll go crush 10 IPAs and a basket of fried food. And it's like, whoa. Those are both aspects of health. We go over here and demonize the smallest minutia of movement in a gait analysis, yet we'll go in ourselves and just destroy internal health. Do you ever sit around those circles? And I know we've both been there. And it's not like we want to say everybody's got to be just this pristine example of health. But I do think, like you said, people look up to us in our own offices, our communities, within our own families. I know that you went down the functional medicine path because of some health issues, but now you're kind of just doing it to, I think, be overall healthy. So what are your thoughts on that?
Well, it was interesting to that point. I was listening to a podcast a couple weeks ago, and the guy said, if you're texting while you're driving, anything else that you're doing in your life to be healthy no longer matters. You're doing the most dangerous thing that is possible.
Yeah.
So, and if you want to live to 60, don't smoke and wear your seatbelt. If you want to have a really good life from 60 to 90, that's where like when you're like I've just turned 42, like I said, I need to do things really well right now to die well. Like, so if I want from 60 to 90 or hopefully to 100 be really good for me, now's the time to do that. You can't wait till you're 65 and say, okay, I want to get healthy now, and wait till you have 3 autoimmune diseases and things like that. So I think that is what, getting human beings to change without having a catastrophic diagnosis is really challenging. Like if somebody gets diagnosed with MS in our office today, we can probably talk them into getting healthy because it's just such a scary diagnosis. But, if someone's got, an A1C that's 5.8 and their fasting blood sugar is, let's say, 101, they're right on the fringe. It's like, what can I say to you to drive change? And Santiano, the famous Spanish philosopher, he called that the gaposis, which is you have your intentions of what you think you should do and what you want to do, and then you have what you actually do. In my life, I try to always like close that gap. I actually work out every day in my life. And there are many days like today that I did not want to be there. And I can't say I was really proud of my workout, but I got in there. I did it. When it was all said and done, I sweated a little bit and I felt good. So half a life to me is just showing up. I feel like in my life, like when people would have just said, no, I don't want to do that, I've said yes to it. And I feel like I'm in a better place because of that. I really do. So I think I'm always looking for things that are getting me out of my comfort zone. Like I actually look to speaking engagements, to things in my life that I'm scared to death of. And I just want to I want to put myself in that environment and just kind of see where I'm at. And it was interesting. I had coffee with one of my mentors the other day, Mark King at MPI. And he was trying to get out of me, like, what is driving your engine? And so after we talked for a while, what it ended up being was I want to push the limits of what's possible for a chiropractor. I kind of walk around, not like in a bad way, but just I'd have a little bit of a chip on my shoulder, like I want to just continue to push, the edges of where people think that a chiropractor should stop. And I want to just continue to nudge on that, and so that can be in the functional medicine world, that can be in the baseball biomechanics world, which that's what I'm really like behind the scenes, really doing a ton of stuff with right now, still in baseball. And I like variety in my life. I like it's got to be something different. So
do you have anything on your radar that's really scaring you? You feel a little butterfly in your stomach when you think about trying to do it or going out there and tackling it?
Now I think I've been just literally lucky enough. I've been on all the bigger stages of like what we do. So those continue. That's a never ending process. So, I got to say too, I got some big ones coming up. So, I'll still 10 minutes before feel like I'm going to shit my pants, and I don't think I guess the day you don't get a little bit nervous is the day you're not alive, but what was interesting in high school, I hated public speaking. Like I would say, there was no one who was more scared of public speaking than me. And now, I make a chunk of my income from doing it every weekend of my life. So, it's not the numbers. It's more like who's in the room, that gets you a little bit nervous, and not nervous. It just, if you're competitive, you want to do a really good job, and it's no different than an athletic performance. You had a huge talk recently. You know how it is. Like you sit back afterwards and everyone's like, oh, you did great. That was wonderful. But inside, like there's some little things that didn't go exactly how you want. So like on the plane ride home, I always try to like reflect, okay, what did I do well? I said this well, but I didn't, maybe it didn't come across the way that I wanted. So just always kind of refining my message to see if people are gravitating toward it, because I think that is a big part of education, is getting them excited for what they're wanting to do. And I just always try to bring energy to wherever I'm at. That way, because this stuff is not always fun to learn. So making it fun for them and making it enjoyable and getting them excited. Because I tell my chiropractic students this all the time. At the end of the day, I still think you picked the best profession. You're $200,000 in debt. they're bitter, they're angry, they're mad at the world. But at the end of the day, I'm just like, I mean, I just can't even fathom doing anything else. Like, I can't even like picture it. So.
And I think that is so cool, that you've gotten to where you are by pushing directly into the thing that was one of your, greatest fears, whether it's justified or not, right? That's the kind of thing with public speaking. We always talk about this social threat, of public speaking and equate that back to tribalism. But I mean, I'm the exact same way, you're getting out for this talk, and I've almost had a couple times where it's like, I just want to call them and say, I'm not doing it. Like, it's just easier. Right. But then
People
after
too, I mean,
yeah. And then after you do it, you're like, it goes instantaneous for me into that, like, oh, I could have done this, but I think that's, again, the sign. And that's not just our field, that's any field, an athlete, anybody. We're continuously, you got to bask in a little bit of the, hey, I did well, I'm glad I did it, an accomplishment, but then it's got to go right back into like honing that skill.
Very few human beings can give their best performance on the biggest stage. So, I mean, we always think of athletes in that example, but like what I tell my students is, if the president of Logan walked down here right now and said, I want you to blow up my CT junction, seat it, how would you do? Would you, like, you got to like show it to them in their world. They're thinking of like Tom Brady. I'm like, no, you're going to go to your small town and your mayor's going to walk in and want to be treated. And all of a sudden your cheeks are going to pucker and you're going to, so are you able on your biggest stage to be prepared mentally to not drop a ball, or if you're doing a big TED talk and you wake up with the stomach flu that morning, like, can you still be prepared enough to where you're fine, and that's what unconsciously competent means. Mm-hmm. That means you can be great without thinking about it. And that's where I really strive for myself every day to be at that level. That way, if you have an argument with your spouse or something's not going right with your kids or whatever it might be, you can still walk through the door frames of that treatment room and not have it affect you. If you're consciously competent, you can have, glimpses of greatness, but you have to think about it, So very, very few humans ever get to unconsciously competent. But if you can get there, then it's the outside things can kind of go away for you. And that's obviously what you want. For the record, I mean, a guy like Tom Brady is just, I mean, like him or not, he can will things his way. Obviously Jordan was that way, Wayne Gretzky, like it's just really strange to watch. Like these really, really, I think we're seeing hints of it with Brooks Koepka, like the golfer now. Like I think like he can kind of make himself relevant when he needs to. Like even like in ACT scoring, some kids are going to do great the day of the test versus what they did on their pre-test. Other kids are going to do way better on their pre-test because they don't have any nerves. Some of us like to be ramped up a little bit because we give a better performance, and other people, it hampers their performance.
Which directly correlates to how much do you enjoy what you do, right? Because if you're just walking in there as in our field, patients are dollar signs, or you don't care to have, even though it's that unconscious competency, it's still the thing that gets me going is that I have to constantly think, right? I've got a short window to basically be the guy or gal when I walk in there that it's like, man, I'm going to try to piece together these 5 different things that nobody's put together and say, well, this could be driving this. And hey, we're actually going to start here. And that's, what usually gives us an edge is that we're not doing the same thing that's been done to them 5 or 6 or 7 times before. So it is, I don't even know how to explain that, but it's almost like this conscious competency of analytical thinking that you're just constantly going in. You have so many data points that you can assimilate and be like you said, you've seen so many things, you've felt so many things that it's just like, man, there's 100 things going on. You're like, oh yeah, that's where we're starting. And then if an intern walked in, they'd be like, how in the hell did you start there? You're like, it's, that's almost that ephemeral, like, I don't really 100% know. You can explain it, but then you're like, there's a little bit of that, like, like we don't know why. Like you said, how's Tom Brady or Brooks Koepka willing that scenario? And I don't think it's a will, right? It's not something that we can't touch and, so abstract. It is the fact that they've been in those scenarios, they own everything so much, and we're not actually seeing that intuitive response. And that's
Yeah, it's like, everyone said like Wayne Gretzky was so successful because he didn't go where the puck was. He went to where the puck was going to be. Well, what's interesting is Bauer, who made the helmets in NHL like 5 years ago, so many guys were getting cauliflower ear because they're taking slap shots off their ears and stuff. So they made a helmet that partially kind of covered their ear. It didn't even last a week because the sound was so much more important for these hockey players. So like if you took Wayne Gretzky as an example, him knowing where his teammates were on the ice was basically neurology. Like it was his keen ability to hear, multisensory integration, great peripheral vision. So it's not this like, as you were saying, it's not this like special lucky skill. It's just, he's got more data points, and yeah. So, I mean, and that's, and like Bobby Fischer said, which is my best favorite example, just because I think it's exactly what we do, is Bobby Fischer said, when I'm playing chess, I'm building memory traces. Okay. So, and what he said was, as I was growing up and I was playing my opponents, they were kind of mindlessly going through the game, whereas he was taking like unbelievable mental notes at the play that he was playing right now, but then the 5 plays down the road. And the analogy I make with students in chiros and PTs is practice is exactly like that. It's no different. It's literally the exact same thing. And it's not just always with our treatment. It's like what you say. It's when things aren't going well, what do you say to like get them wired back into what you're doing? And that's where I think you and I will never burn out, because as you mentioned, it's kind of a game within a game. Like every patient, like we have our difficult personalities, of course, but I'm more attuned to their body and the changes that I'm making within their body, which just makes all the other stuff go away. And I'm just fascinated with like how I can change the function of their foot and change something else far away in their body. I just think that's just unbelievable, so I'm always like working on those little things within every patient. And that's why I literally don't burn out. I mean, give me a day off, give me a day in the clinic. I mean, it's the same to me, like, cause it's being it. I know, cause all my friends, I've been out almost 20 years. They're going to say things like, it's a grind. I don't like it. I'm looking for other things. Even like, you do teaching too. Like on the teaching circuit, a lot of times people retire to their teaching circuit because they're tired of practice. Mm-hmm. Like, I don't know. I just think I love clinical practice, love it because of the game of it. Like that's why I think, because I'm just a competitive person and I want to keep like pushing the limits of what's possible, of getting people better. And,
So when you talk about you want to push what a chiropractor can do or be, or kind of the, what do you kind of see yourself doing in 5 years, maybe even 10 years? Like do you have like, I guess let's kind of look at a little bit of the process of Brett Winchester. Let's get into the psychology here. Like if you set that kind of big, I guess, idea or postulation about what you're going to do, like, are you writing down specific goals? Do you just have things in mind that you would like to happen? Or are you attacking, like you've got very specific kind of timelines for the next like couple years and out into the next decade?
Yeah, I mean, I look at, I first of all, I look at my life and I think no one does anything that great after the age of 75. Like, hopefully I'm still alive and well, but like, I mean, there's outlier examples, but by and large, like at that point, you're probably hanging out with your family. You're still, and definitely enjoying your life, but you're not like in that phase that we're in right now, which is, I would say, more of like a warrior phase. So I'm a realist. I know that, I have finite time to do what I want to do. So I always kind of give myself a little bit of a sense of urgency. I always have a little bit, I kind of know where I need to be for my age. Let's put it that way. So I would say so far I'm happy with myself. Like I think for 42, I've done a lot of the things that I wanted to do before 40 and 42. The next 20 years are about refining where I'm at right now, which is my office in Troy, Missouri. So I am just trying to get, I tell my employees, either you're here because you're the best in the world or you have the potential to be the best in the world. And I am just really working with everyone that I got here to really drive that. I'm real now. I love group practice and I just have the best people here. So like coming to work here is just, I mean, when I tell you it's a joy, it's like walking into a fraternity house, basically. We have so much fun. But I want to continue not only to help myself, but now I'm at a point where I want to help everyone around me. And so I'm going to do everything I can to help the people that are in my office. And that's literally everybody. That's my CAs. That's the people at the front office, my office manager, my chiros, Rebecca in functional medicine, our trainers, Sheila, and we got a new one, Natalie. So yeah, I really want to, really kind of push everyone around me and just kind of see where we can take this. Cause it's fun. And that's why we have the name Gestalt as one of our side companies, because basically together we're so much more strong than we are by ourselves. I've been on an island before and you can have success, but it's just not nearly as much fun for me.
Mm-hmm. And
I'd say the next 5 years, writing's the other thing. So I've got a lot of writing I got to do. So that's I now took off Tuesday afternoons. That's why I'm free right now, so I can do more of that. I guess the other thing is my kids are at an age where I need to be there for them. So they're obviously playing sports, and so I try every day to play sports with them and hang out with them in our crazy life. And so that's going to sum up the next 5 years. I kind of know what I want for till I'm 45, which is kind of that education piece. I want to really drive that. And then at that point, then, we'll have to see whether or not that takes me in other sports or, we'll just have to see on that. I don't have anything like finite exactly where I see. It's just like, if I keep back, rewinding my career 5 years ago, I wouldn't have thought I would be where I'm at now, and the same about the 5 years before. So I always tell everyone here, I'm like, I can't even imagine what the next 5 years are going to bring for everyone around here. So, and we're all kind of coming into our prime. That's what's fun. I always tell, like, the mean average for a professional athlete is 24, but your brain's basically at its peak when you're 42. So my new joke is like, I'm at the mountaintop right now. So this is good as it gets. It's a slow decline from here.
I know you've authored a couple chapters in books. So is there a book coming out? Is there something?
Yeah. Oh man, it's so hard with, as you know, cause you've done some writing too, like on the referencing side of it. And like, if I do a book, like, yeah, we're currently working on some books for baseball and softball. I just want it to be relevant 40 years from now. Mm-hmm. Like some of the books, like whether it's a cheesy picture or whether it's a cheesy exercise, it immediately becomes irrelevant, in 5 years. But like, if you look at like Ted Williams' book on hitting or Ben Hogan's book, whatever it's called, 5 Lessons, whatever, mm-hmm. like those books have stood the test of time. In 50 years from now, you could pick up those books and they're still relevant. So whatever I do, I want to be sure that it's like that. It's not like a fad thing, and it's not, that's kind of, I think that's hard, and I would rather it be a book. I'm not a big fan of like just a manual. I'd rather it be like an actual book.
Well, and two examples that come to mind on that are Harvey Pinnock's Little Red Book. It's super simplistic, right? But my copy looks like it's in tatters. I got it secondhand. But it's almost maybe just a memento for most golf pros. Everybody has it. It's kind of a read, but there's so many, of his analogies and how he understood stuff that seems very, he had his kind of country way of explaining things, but it made it so easy to understand for anybody. And I think a lot of golf pros and golfers could just take that and be like, oh, it makes sense. Like, that's easy to explain now. It took these complex issues. The other one that's, I think, going to stand the test of time for a long time in our field is like Leon Chaitau's book on breathing, right? Did a wonderful job of assimilating multitudes of information. And yeah, some of it may be getting a bit dated as more research comes out, as any scientific work will, but did a really good job of taking multiple things and kind of piecing together and giving us kind of just a 10,000 foot view of like that, right? Nothing too specific, but nothing, so simple that it's just like nobody can take anything out of it. But like you said, I'm writing a book on trail running, and I don't want it to be, man, I want to sell it now, the next 5 years, cool. And then it's just like, man, what was I doing? I'm kind of a little ashamed of that thing. I wish I could pull it off Amazon. I wanted it to be something that's like, all right, I'm super proud of this. I wasn't just trying to pump a book out, which nowadays you have to be very aware of because there's so many just self-published, ghostwritten things out there. So it's hard to sift through that again when people see just, oh, this guy has a book, cool. Well, no, you want them, when they get into it, like, holy cow, this is awesome. So this brings me to, let's talk about what you're doing a little bit more with your side education company. And I know your crew there has been ramping you guys up on social media. There's a lot of info out there for like docs and also patients. When you see things online, whether it's like a personality that puts out information, about movement and things like that, where do you think you guys, like what's kind of your mission statement for what you're trying to put out there for other physicians and doctors and also the Gen Pop? Like, how are you guys formulating what you're going to put out there?
Yeah, I think that's like, unfortunately, because of, where baseball was for me the last 5 years, some of that just, I felt like got bottled up, like where I felt like I was growing a lot daily and I just didn't have literally the avenue to kind of talk about it. So I feel like now, to me, like to answer one of your questions, if I look at people online, one thing, like if I see cockiness, I immediately know we're dealing with a charlatan who's not in practice. So like if I see that come across in any way, like this is the only way that it's going to be, I can bet you that if we follow them back to their hometown, they're not in private practice, because there is nothing more humbling than getting your teeth kicked in every day of your life in clinical practice. You can't be cocky in what we do. It's just not possible. So I'll start with that. I mean, that's like an automatic red flag for me. And then I think the more I've learned too is how important hitting the patient with many different aspects. So you got to be good with your clinical skills, but also you're a motivator. You have to scare them when they need to be scared. You need to be able to drive change. You need to not be cocky, but be very certain with them. And you got to have like a little bit of enthusiasm about you, which means, like I said before, you got to bring energy into whatever space you're going into, and I really try to work on that, because if you're not excited about Leanne Chateau's breathing exercise, then they're not going to be, and I think the other thing would be like with the students is I think because of the pendulum that I was telling you before, we're thinking we no longer need to palpate our patients. So that is another issue that I have. I think like it's like asking you, saying, Beau, can you feel whether or not your tooth is loose? Well, of course you can. And then I say, well, show me, prove it to me. Like, what's the evidence that your tooth is actually loose? And that's what like certain people in our profession are trying to like do right now. And what it's doing, it's really hurting our students like big time, because the students now are like, well, if we can't palpate and that information doesn't mean anything, then why does it matter? And I mean, I guess where I was really lucky, I was just around like a Lynn Fay, a Carol Levitt, the present day collage, like these people who are Mark King, who are so talented with their hands. Unless you're around that, then like I could see how the student could be wooed into thinking, oh yeah, that's a bunch of malarkey. You can't feel it. Now, I mean, like if we just use manipulation, like if I don't know how to joint play, I'm done. I'm just literally guessing at that point. So it's kind of a frustrating, like if we get in these arguments, which we do, some things we're just not going to be able to put numbers to. You're just not, but I've been around too many greats to know how important like the skill of palpation is. And then, so you take that and then you marry it with great therapeutic exercise, soft tissue techniques, functional medicine, change diet. I mean, you are just the most important person in their healthcare team by far. It's not even close who's second. So I mean, I like to see, I don't want to be known as like a spine doc. I want to be known as a primary care person. I want people to come to me with everything. I'll triage them and then, we'll get them in the right spot. So,
which is, I think I found this really interesting. So we got into a debate. I say we, Sloan and I, with a orthopedic surgeon here in our town. And it was somewhat of it didn't get out of hand. It was an okay debate. No heated responses, but basically the fact that we shouldn't be called a physician, let alone be a primary care or primary portal. And their reasoning was that we weren't trained well enough to be able to triage, which in our state, the physical therapist just lobbied to the state, which it got voted down, to become primary portals of entry. And they actually had a lot of surgeons coming in and saying, no, you don't have the qualifications to basically triage well. What I see with a lot of kids that are coming in to intern or asking questions is, even though we're taught really good diff-die skills and really, all of our basic sciences and everything in school, we're coming out and we're thinking that we shouldn't be that, right? Or you have a lot of chiros that are saying, no, I want to be very much the musculoskeletal movement. I want you to directly go to your primary care. But one of the number one complaints I hear every day, and I know you do as well, is somebody goes to their primary care internist and it's just, I got this. Okay, I'm going to give you that. Or you got this. All right, you're getting referred to specialist. There is no Tom Brady, AKA quarterback of health, in most people's lives. And that's what you're saying you want to be. And I try to be that for everybody, which takes, again, a lot of input and analytical thinking, and also empathy. The fact that you need to care for their scenario, not just their knee, right? Care for the person. And I think we're starting to miss that with some of the things that are kind of being matriculated through school, and, this ideology of like, I'm just a movement guy or gal and that's all we do and everything else is outside of our realm. Well, that's not why we're called a chiropractic physician in the first place, right? We're primary portal because we're supposed to be good enough to triage. And then in our worlds, we also understand that a lot of these things are, functional medicine based. They can be improved through environmental shifts, and it doesn't always take massive intervention to change these, things that seem just drastically to be, reducing their quality of life and their health. So I don't have I don't have a good postulation of how to change that, but I think it's a disservice to our profession to see young clinicians coming out thinking that, like, as soon as they see something that seems out of their realm, it's immediate, get out of my office. Give yourself a chance, like get a good diff-die, see what's going down. I'm not saying treat cancer. I'm not saying treat an upper respiratory infection. I'm just saying do a good job and do what you're supposed to do. But I don't think that happens near as much as it should.
Well, I mean, that brings us to kind of an important point, which is, there's a lot of people in our world, our circles, that they're saying things like, well, we're just becoming a blend with physical therapists, ATCs. Like in 10 years, we're just all the same person. I don't know.
Yeah. What is your thought on that?
Well, there's physical therapists who are in the top 20 best manipulators in the world. And to your point, they didn't learn that in school. Just like we may not have listened to many hearts as somebody who went to medical school, that doesn't mean we can't be great at it later on. Chiropractors who think that PTs can't get good at manipulation have lost their mind, because they can, if they have a little bit of grit and they get in the right circles, they're going to get good at it. Think about it, So me, I'm not a hater on anybody. That we'll just leave it up to those professions on whatever they want to do. But I look at our profession, I think it's really pretty important that we don't just become known as spine docs, and I get the argument. It's like everyone uses the analogy of like the podiatrist, they just own the foot and therefore they kind of carved out their niche. And, I look at what I do every day, and I work on spines, but gosh, I work on so many different things,
Mm-hmm.
And again, we're going after the special group in our profession. Like other people have more of a grander vision. Like, I want this model to be in every hospital across the whole world. I really don't have that vision. I want to create, to use an analogy, Navy SEALs of chiropractic. I want the people
like the Yuval Harari, we need commandos of health, right? And that's kind of
I want the ones who are up late at night, up early, trying to make themselves better, to do what we do. I'm not looking to have our model just be planted everywhere. I just want the best people to be in it, that are willing to work hard and get good at it.
When you're, let's take it on a macro scale there, from even looking at the economics behind it. I can't remember who I was listening to, but I think it was Naval Nikit, the guy that started angel investing. And he was kind of talking about the perfect size of an organization, and saying when it got up to 1,000 people, it became far too policy driven and you didn't have the human aspect of decision making. And he was kind of saying how 10, and I may be misspeaking on who said this, but 10 to 100 was your perfect realm, because you had like everybody in there was invested in the company, invested in the idea. They were constantly trying to make each other better. And when you got outside of that realm, it just kind of fell apart and it became this kind of system, which, you know, you think about a large hospital and like how a really, there may be fantastic, and there surely are great clinicians in every hospital around the world, but they get lost within the minutia of just that kind of machine, you know, and it's hard to, you know, elevate that hospital. It's just, it's the thing and you're in there. But you get a smaller group and it's like, hey, we all want to be the best. This is our idea. Let's keep moving. You can pivot, you can shift. And I appreciate that, because you are in a position where you could 100% capitalize, right? You could franchise Win Spine and Sport and, you know, go out there and just completely almost be hands off at this point and just kind of create a cookie cutter experience for patients, which would probably be pretty good, but not the best. You know?
Right.
And I think that's what you're after for sure, which is why I constantly applaud you for that.
Yeah, no, I think that's right. I mean, I think that's, I'm a little bit of a perfectionist. I know you are too. You know, I mean, my thing is, if we're all going to come here to work every day and log the time, let's try to be world-class at it, you know? And then in saying that also I like to think I'm good at getting the most out of people that are around me, like really kind of pushing their capacity to beyond even levels to where they think they can go. Because really, if you think about it, very, very few humans are functioning at their capacity. In fact, most are like, they're like 20% probably, you know? And that's where I think group practice really helps, because I mean, I try to create like a true teamwork, which is like I truly want what's best for you. Mm-hmm. Like that's kind of hard to find, you know, like, I mean, cause there's jealousies, there's envies and things like that. But if everyone could just put that aside for a second and just say, okay, no matter who you are, I truly want what is best for you. What can I do for you? What can I do to make that happen for you? And then that's when you get like a magical alliance and teamwork, you know, and that's what we're striving for sure.
Well, I had an interesting conversation with a friend that's playing professional basketball in Germany, or Sweden actually right now. And I was kind of just asking him how he's liking it over there. And we kind of talked a little bit, and he kind of just looked at me. He goes, it is so different because everybody over there is working towards a common goal. Like everybody wants everything to be good. He goes, over here, it's like we're trying to step over each other to get better. Like we're willing to like stab somebody in the back and like, no, not invest time in somebody and like take resources. He goes, it is completely different mindset in Sweden and Germany where he's played. He goes, it just seems more collective. So there is a cultural aspect to, you know, the capitalist system that drives a lot of what we have to do as business owners. But then realizing that really we didn't go to school to be business owners. We went to school to be chiropractors, and that does come first. And if you do that better than anybody else in your area, like you always said, I mean, I've got all my Brett Winchester quotes written down in a very beautiful leather-bound journal somewhere on my shelf. But be the best in your town, then be the best in your state, then try to be the best in your country, then try to be the best in the world. And you can do that without sinking everybody else's ship. And I like you said, that is rare though. Like, so again, I applaud you for that.
Well, think about like Showcase Baseball, a 10-year-old baseball team. Now they literally are rooting against their own teammates because they're wanting their son or themselves to, you know, to look better. So like the whole teamwork thing is gone, you know, it's really a shame for sports. You know, that's what I hate to see. And the agents have kind of done it in professional sports too, which they're looking out for the players' interest. But unfortunately with that, they're also not looking out for the team's interest, you know? So there's a dark side to professional sports for sure. There's a dark side to Little League sports. You know, you see the worst traits in human beings on a Little League baseball field, you know, like it's just
parents and children. Yeah.
Yeah. I mean, you just scratch your head on like, I mean, my God, have we really gotten to that point? But what's hard is like now, like with sports is if your kid doesn't play on 3 teams, they're behind, you know? So like, it's so easy to say, oh, that's ridiculous. That's ridiculous. And then you live it, you see your kid in it. And, you know, then it's a little bit different ballgame when you got to kind of start making those decisions of, do we want to give up our whole life to have my daughter play select volleyball or my son play select soccer? You know, like, does that make sense? You know?
Well, I had I don't know if you saw this, but talking about teamwork and how, basically rising tide elevates all ships, how the ACBSP and the ACA Sports Council and FIX all just joined up for the first time ever. So that's, even though, there's still these political kind of banners within our field, but to see that stuff happening is cool, right? Like, we're actually kind of setting aside like our political differences or whatever you want to call it and saying, hey, let's just kind of team up and like, push this overall message and like some of the shifts in the ACA for better or worse. So there are good things coming even within our own profession. So I you hear it all the time. I think everybody says it every year, but like, it's a fantastic time to be a chiropractor, or, any kind of conservative musculoskeletal physician. So,
and even I spoke at the ACA thing this year in Orlando, and they were great. I mean, they were amazing. I was like, I think at the end of the day, I mean, some people just need to see what we've been lucky enough to have in front of our faces, so, and then once they see it, then they're like, oh my gosh, where has this been, And I think, for the most part, I mean, this is chiropractic has got a great family. I mean, a good core group that, wants to get their patients better and, so.
And make everybody else around them better. So let's hit these 2 wrap-up questions. These are always fun.
Okay.
So what is something, could be personal life, could be clinical practice, could be business. What is something that you long held true that you had to completely change your mind about or pivot due to evidence or experience or what have you?
I would say probably in the last 5 years, I think really getting on board with some of like the MDT research. I would say like, I just think like I thought like originally I kind of knew it. I was bastardizing it. And then I got around some people who are really good at it. And they showed me like a whole different level of that. So I would say that, where I used to kind of think I knew what a derangement is. Now I'm like that part of MDT is so powerful. I mean, so crazy powerful. That I probably 5 years ago didn't put enough importance in. And that's not just in the spine, that's also in the extremities. So I think that classification of MDT is probably the area that is just like probably blown my mind the most. Trying to think what else. The other thing would be like, for being probably the most medical orthopedic person in my chiropractic class when I graduated, I think they'd all be really proud of me. I'm like just the biggest hippie now. I guess I've just like learned. I mean, I definitely really, really appreciate really good Western medicine, but I've really kind of also learned to understand, the other side of getting healthy that is, a lot of times can be outside drugs and surgery. So knowing when to use that's great. And typical Americans are entering the funnel the wrong direction. So I try to get them to enter through our model, and then if we need Western medicine, by all means, we got the best people to do it.
So what you're saying is there's, in addition to your clinic, there'll probably be a nudist tribal commune coming in the future sometime as a business aspect, correct?
Yeah. You want to come?
So the last wrap-up question is the exact opposite of that. So what is something that either you find yourself telling patients, doing in clinical practice, or that you're just constantly toying with the idea that has no empirical data, that has no research, but you're like, man, I know this has got to be true.
Palpation.
Oh, there you go.
Palpation. I mean, this is where like on Facebook, I got to be honest, like at this point, I have the energy to fight. But like when I see people say crazy things about like not being able to joint play or feel joints move, it takes everything I have not to put my head through a window, like, because it's so wrong. But I don't have, it's not something you can put numbers to, but I think what's happened is early on I was learning. Now I've done it so much. And especially now that I'm like officially teaching it in a curriculum at a college, like I know how important it is and how true it is, and so I'm going to spend the rest of my life on a crusade to potentially do research on it, but also just to invigorate students on how important this is. And don't let someone tell you that you can't feel the SI joint move. You absolutely can. Are you going to feel it the first time? No, you're not. I didn't feel it the first 100 times I felt it. But that's the journey we're all on. And that would be, that would definitely be, and that goes for soft tissues too. I mean, being able to palpate soft tissues tells me so much, you know? So it's not just joints, nerves. I mean, if you listen to Michael Shacklock, he'll tell you and show you how to palpate multiple nerves throughout the body that you had no idea. I mean, who knew you could strum the sural nerve in your lower extremity? You know, like I didn't know that in school. So, I mean, just like little things with the palpation. I mean, you mentioned Leon Chateau. He's a perfect example, you know? You mean to tell me Leon Chateau couldn't palpate soft tissue? Are you kidding me? Right. So, I mean, and I guarantee you in his final days, he would, if anybody would have listened, he would have said, trust your hands. You know, I mean, there's so much that can be gleaned from, you know, what you can feel with your hands.
Well, the fact that you're teaching in a standardized curriculum, all I've got to say is those students are extremely lucky. So that's one thing. The other thing is, if there's students out there or docs that have never had the opportunity to hear you speak, you always, the one thing that people consistently say when, you know, we kind of talk about you presenting is like, you do bring energy, you bring humor, even if, you know, you don't always get it. Like, you're still a funny guy. But you inspire through your energy. People see that you're fired up about it and that you know, you're living out your passion, which that is really important. Like you said, in a field like ours where it can get, like it can wear on you, right? It takes energy to think and interact with people and, you know, run a business and all that stuff. But to see somebody that's not just throwing information at you, but throwing it at you in a way that like shows you that they're getting the most out of every day of their life for what they do is just awesome. So I've said it numerous times, but like, thank you so much for what you do. Thank you so much for what you've done for me personally, is like a mentor and just, you know, kind of blazing a trail for a lot of us, but myself included. Anything you want to conclude with, man? Anything, sage words of wisdom as your ripe age of 42? I know you got to have something in there, man.
Well, yeah, I'm at my peak, remember? So
I know.
Sew it on a pillow. This is going to be good. I just think relationships, you know, I mean, the longer I'm alive, the more important. I lost my mom last August. So like, I would just say like, of course work's important, but you know, I mean, the relationship with your kids, the relationships with your friends, having a good vast mesh of friends. And, you know, when they look at longevity studies, it's not exercise. It's not diet. It's relationships, you know, like, I mean, those other things are important, don't get me wrong, but I think like having really solid relationships around you is really, really important, which I've been lucky enough to have. I mean, for example, if you're in a bad marriage or things like that, not that you can't do great things, but it just makes it tough. You know, I mean, I have a really understandable, you know, wife that lets me travel and, you know, do the things that I want to do. So I think that definitely helps. That would be probably the biggest thing I would say. And then for the newer generation, you know, like not to forget about the grit piece, the hard work piece. You know, sometimes the younger generations can be a little bit entitled. So yeah, whatever we can do to battle that. And, but then our generation sucks at technology. So like my younger docs here, they're so good at it, you know, like I'm envious of them. So I'm working every day to get better at it. So yeah.
Well, again, you're an icon in the field, man. Keep doing what you're doing. Keep pushing the limit. I'll put up links to your website, social media outlets, everything, so people can get a hold of you. And again, I can't thank you enough for being on the show, man.
Oh, and remember, you remember how hard I tried to woo you from the beginning to work here. So if you want to come up to Troy, Missouri, we'd love to have you.
I would love to relive my fraternity days. So.
That's exactly what it's like. You're too classy for this place.
I'll leave everybody with one more Brett Winchester piece of advice talking about the grit aspect. So you one time told me when you're from 20 to about 25, maybe beyond, you got to bust your ass. That's your like, just work as hard as you possibly can.
Say yes to everything.
And then 25 to 30, you slow down a little bit and you start to create a filter. And you kind of told me if you do that, you set yourself up for a huge win. So if there are any young docs or people that, you know, are in other fields, but they're just, you know, young professionals, like think about it like that. And I think it sets you up for not having to play catch up later or feeling like, especially nowadays, there's no retirement in sight because 42 is young now. So set yourself up for a win, and especially a healthy win, like you said. So it's not just about financial success, relationships, health, everything we talked about today. Thank you so much, man. And we'll definitely be having you on again in the future. And yeah, Thanks.
Congrats on all your successes, Beau. Nothing makes me more proud as an educator to see people like you to, do the things that you've done. So you keep it up also, and we'll catch up soon.
Absolutely.
Paid up, and we want to think about creating this little foot, and we think of a bunion having a little kick.